Okay, today we're going to talk a little bit about some of the tools and equipment and devices that are available to help you manage rehab patients, and especially to support ambulation in patients who haven't yet fully recovered function. And so we're going to talk a little bit about what's out there and how you might be able to incorporate that into your practice. Before I begin, there are a few general disclaimers I want to make. Just let you know that everything in the following discussion is based on my personal experience, the experience of colleagues who've shared with me preferences about different equipment that they use, as well as feedback that I've gotten from clients over the years. This is not intended to be an exhaustive list of everything that's available out there. That would take more than the hour that we have available. And it's not intended to be a shopping list either. These products are available, but they aren't essential. And it's up to you to pick and choose what's going to work best for your patients in the environment and the clinic setting that you are working in. Mostly the goal today is to give you an idea of what's out there and what you might want to look for and choose from as you're going through your design of your program. I don't get any kickbacks, financial or material compensation, or any kind of recognition or acknowledgement from any of the companies or the suppliers that I'm about to discuss. I have used most of the products that I'm going to talk to you about, and so I do have some familiarity with them, but I don't get anything for promoting them or for telling you the drawbacks. So just understand that everything that I'm talking to you about today is my honest opinion about how these products work. I also can't endorse and I don't want to imply endorsement of any of the products that I'm going to mention. The products that I've used at the time that I've used them have served me well for the most part, and when they haven't, I will let you know. But of course, design of products, manufacturing locations, ownership of different products can change over time. And because of that, the materials that are incorporated, customer service issues, those kinds of things may change and may not be completely current at the time that you're watching this presentation. Again, this is just meant to be a representative sample so that you have an idea that things do exist and are available, but not a complete list. And I absolutely, during the lab section of the course, welcome conversation and feedback about products that you have used that I might not yet be familiar with. If you can, whenever possible, I do recommend buying products directly from the manufacturer. In my experience, you get the best customer service that way, and you also are going to have the most confidence that the product you're using is truly the product they intended to put on the market. When you can't buy from the manufacturer or you choose not to, definitely shop around. The different retailers, especially big box companies, Amazon, Target or Chewy, Walmart, are going to vary from location to location in terms of, or from site to site in terms of their price for a given product. So you may be able to find that product at a significantly lower price if you just look around at a couple different sites before you buy it. General considerations when you're looking to purchase a device for your practice. Things you want to keep in mind. The first overarching consideration is, what's the objective? What's the goal? Why am I recommending this product? Why am I going to either want to keep this product on site in my hospital or have a client take it home and use it at home? And sometimes the considerations for one or the other can be different. What benefit do I expect my patient to gain from this product? And so knowing with some specificity what you expect to accomplish can guide your selection of product, especially when there are a number of options available on the market that are only slightly different from one product to the next. That may make all the difference in which one you choose. How is the device going to be used? When is it going to be used? Is it going to be used once a week when the patient comes in to see you? Is it going to be used every day? Is it going to be used all day? All of those are considerations in terms of deciding what materials you want the product to be made of and how durable you need it to be. Again, is the product going to be used in your clinic or at home, or is it going to be taken back and forth? How easy is it to transport? Where is it going to be stored? Those kinds of considerations. How durable is it? Are you going to be using it on multiple patients, which brings into consideration sanitation and basic equipment care over time? And again, can you wash it easily? Can you sanitize it? Can you throw it in the washing machine, or do you have to hand wash it? Do you have to take it apart to wash it? Are some parts washable and others not? Those are all things you need to consider in terms of maintenance. Does it have sizing options? Is it adjustable? If the size they have available doesn't precisely fit your patient, can you adjust it to make the fit better? If not, you may seriously want to consider other alternatives rather than buying a product that might be expensive and turn out to be uncomfortable or unworkable because it doesn't fit your patient. Will the patient be comfortable in the device for an extended period of time? And this, although I put it lower in the list, is maybe one of the most important considerations, because in terms of your success with the patient and your ability to use that device repeatedly over time, if the patient's not comfortable in it, or if it's pulling on hair or fur or rubbing at the skin, then it's certainly not going to be a practical piece of equipment, even if it accomplishes your goals fairly nicely. Do you need to replace parts on a regular basis? Are those included in your purchase price? Can you get those through the manufacturer, or can you easily purchase them through a third party? What kind of customer service does the manufacturer provide? And that can make all the difference in your satisfaction with a product. And in general, rule of thumb, the more complex or more essential a product is for your patient and your therapy plan, the more important that customer service becomes. So let's just go ahead and start off with the big one, and talk a little bit about wheelchairs. So I will tell you that in general, I'm very, very conservative about using wheelchairs in my practice. In general, in my opinion, if a patient has motor function and is able to support weight, you may be doing them a disservice by putting them in a wheelchair. And that's not to say that a wheelchair can't be useful as part of your rehab therapy program, but it should not be the mainstay of a rehab therapy program. Furthermore, I find that a lot of clients who come in asking for a wheelchair from the beginning are under the impression or have this idea that a wheelchair is going to solve their pet's mobility problems. It is going to be a resolution. And it's really not. It's a tool, and it's a useful tool, especially for a patient that is non-ambulatory, and we expect them to be non-ambulatory long term. A wheelchair can have many benefits for those patients, but clients do need to be reminded that they're not going to be able to put their pet in a wheelchair and all of a sudden it's a fully mobile animal 24 hours a day. Pets in wheelchairs should never, never be left unattended, not ever. In my opinion, there's too much risk for falls, getting tangled in straps, something breaks and the pet can't get out of it, or the part is going to cause injury to the pet while someone isn't watching. In addition to that, a pet that's going into a wheelchair for the first time or the first several weeks of acclimating, it's a new body posture, it's a new body position. We're using new muscles or muscles that maybe haven't been used for quite some time. And there is an acclimatization period where you need to build up the strength and the stamina in that pet for long-term use of the wheelchair. So the first several weeks to maybe even a month may involve very, very short periods in the wheelchair to prevent fatigue. And we're talking 5-10 minutes at a stretch. Even in a pet that is fully acclimated to the wheelchair, the client again needs to be reminded that they can't do things like sit or lie down, which are normal body posture changes for a healthy animal. And even for us, standing for long periods of time in one position may be comfortable initially, but after quite some time, you're going to want to sit down or stretch or move around or do something different. And the wheelchair confines the patient to a limited range of body positions. And for that reason, even after your patient is fully acclimated to the wheelchair, it's ideal for them not to use it for more than 30 to 40 minutes at a time without being allowed a rest break to get out of the wheelchair, stretch their legs, maybe lie down, rest their shoulders, those kinds of things. And so that's really not a long stretch of time in the course of the day. Doesn't mean that a client can't put the dog back in the wheelchair later on. And in fact, most of the time with wheelchairs, what I recommend is use them as you would have done for that patient on its normal walk schedule prior to the injury or illness that's caused debilitation. So if you normally walk your pet for 20 minutes twice a day, that's about when you're going to be using the wheelchair. The wheelchair can be used indoors as well. However, you want to be careful about stairs, corners, getting stuck behind furniture. Again, all reasons why pets cannot be left unattended when they're in the wheelchair. So there are definitely some prerequisites in terms of setting expectations for you and for your client in terms of what the wheelchair can and can't do. For patients with spinal cord injury, which is the majority of my clinical practice, you in general are going to want to wait and see what kind of recovery you can expect for those patients before you decide to put them in a wheelchair. Unfortunately, wheelchairs don't provide weight-bearing exercise, especially for the rear legs, but if you've got a quad cart, it's for all four, and they don't give the patient the normal proprioceptive feedback that you would get from normal standing and walking. Even in the underwater treadmill, patients are going to get more of that feedback than they would in a wheelchair. And so if you decide to put your patient in a wheelchair, understand that their recovery may be incomplete. And if you rely on a wheelchair for the majority of your rehab, if you do have the patient do most of their therapy exercises while in a wheelchair, you may actually set them back, and that patient may become reliant on the weight support of the wheelchair to the point where they can't ultimately ambulate independently. So you do want to be careful about putting a patient in a wheelchair too soon. And in my opinion, if a patient can walk, they should never go into a wheelchair. Even if they can only walk for 3 to 5 minutes before they fatigue, that is far better than for them and their physical health than, say, a 10 or 15 minute walk in a wheelchair. Now, could you do both, alternating your unsupported walks and wheelchair walks? Absolutely. And I think one of the biggest benefits that wheelchairs have for patients is the environmental stimulation, the mental stimulation that it provides, the normalcy that it provides for the patient, being able to stand up and walk around independently without waiting for someone to come pick them up, and to have a little bit of self-determination in terms of where they want to go and when they want to go and how fast they want to go. Those are all important things just generally for keeping the patient's spirits up, if you will. And I think that in that regard, wheelchairs do offer some benefit, especially for patients where we expect them to be incapacitated indefinitely. The other big benefit of wheelchairs is going to be medical. So having a patient in an upright, appropriate posture reduces fatigue. It helps promote normal core strength. It's going to help with respiratory health, urinary health, especially if the patient can be trained to urinate while standing in the wheelchair. It's just a more normal physiologic body position that allows physiologic function to occur in a more appropriate fashion and may help prevent things that are very common in patients that are non-ambulatory, like secondary infections, which can be devastating in terms of patient care and management and ultimately patient quality of life. That being said, if you do choose to prescribe a wheelchair, it's important to get the wheelchair fit correct. I generally don't recommend reusing wheelchairs for different patients unless they're highly, highly adjustable. And I have had, and you will encounter, clients who have more than one pet with a similar disability. And the temptation or the inclination to use one wheelchair for multiple pets is strong because they aren't inexpensive. However, fit is so very, very important. You don't want to inadvertently increase strain on one part of the body because the wheelchair hasn't been fitted appropriately. No matter how happy and comfortable and mobile the patient is when they're in the wheelchair, coming out of the wheelchair, they're going to be more sore, and you may actually induce further injury if the fit isn't correct. So each wheelchair company has their own fitting guidelines, usually on their website, but certainly I've had very good success calling and just asking for their input about fit as well. And most of them have excellent customer service where you can ask a lot of your questions over the phone. If you are looking at a wheelchair that you haven't fitted, or even if you've fitted it, when that patient comes back in for their first assessment after the wheelchair, and they should, as a sidebar, when you're prescribing a wheelchair, it should never be a one and done. You send off the order, send the client away, they receive it in the mail, and then you never see them again. You really want to see that patient back, even if it's only one time, to make sure that that wheelchair fits and that the parts are appropriate and that they got the service that they needed from the wheelchair company. So you can be there to facilitate communication, absolutely. But when you're looking at a wheelchair for fit, there are a couple of key points. There's a lot of subtleties, which we won't go into right now, but there are a couple of key things to look for. The horizontal support bar should be parallel to the ground, and it should cross at approximately the coxofemoral joint and the glenohumeral joint, which are, in most dogs, are going to be on the same horizontal line. But it should not be lower than that, because then it may not provide sufficient support. And anything taller than that is going to be awkward and more prone to tipping. So it really should fall in a horizontal line that's parallel to the ground, right about the hips and the shoulders. And so all of these pictures that I have here are examples of good fit. I have plenty of examples of poor fit, but I think those are less useful. It's most important to really just focus on getting the fit right when these patients come in. The other thing to make sure of is that when the feet are planted on the ground, even the rear feet, if you are giving rear support with a rear wheel only wheelchair, all 4 feet should be planted so that the entire palmar or plantar surface of the paw is in contact with the ground. If the pet is kind of tiptoeing along in the wheelchair, then it's too tall. And if they look a little bit like they're crouching and there's too much flexion in the carpus or the tarsus, then you probably have a wheelchair that's too short. And it's amazing how subtle the difference is between a wheelchair that's too tall or too short and just right. Sometimes the adjustment is really, really very minute. One thing I didn't put in writing in this presentation, but you might want to consider, is if you are going to do a lot of work with patients who are in wheelchairs, invest in a set of Allen wrenches and socket wrenches. And you can go to most hardware supply stores and buy a set for relatively inexpensively. But I do think that that's going to be important because it will allow you to make adjustments in the clinic without having to send the wheelchair back and forth every single time. And I think major adjustments really should be made by the manufacturer, if nothing else, to make sure that they're done right and that the manufacturer is going to honor any warranty that applies, but also because you want to make sure that the manufacturer is aware of any differences between the cart that they initially made and the cart that ultimately you're going to need to use, because those may be points of communication that we need to emphasize or really polish up before we order the next cart. So I have worked with all of these companies and they all make an excellent product. I think that in terms of maximum customizability, Eddie's Wheels is really going to give you the most customized cart for your patient. The canine carts is a little bit in between in terms of customization. Walk-in Wheels, or the handicappets.com product, is a much more off-the-shelf product. It is highly, highly adjustable, and for the most part, I have found that it works for the majority of patients. It is a little bit less expensive because it is made more standardized. They have set sizes, and within each size there's a certain amount of adjustability rather than making a custom cart for each patient. So there are pros and cons to each approach. Most of the wheelchairs that I've got pictured here are wheelchairs that you're going to have your patient use at home for the most part. Occasionally, if you have a hospitalized patient, especially a long-term hospitalized patient that's very, very large, it becomes helpful to have a wheelchair or some kind of ambulation assistance in hospital. And so on the right-hand side of the screen is the Eddie's Wheels quad cart, which is not intended to go home with the patient. It's intended to be used in hospital. It is a single, extremely highly adjustable cart that you can use for most patients within a given size range. And you can't use it for all of your patients in every size range, but if you have one for a medium to large sized dog, that's generally the most often you're going to use it. And this allows you to get dogs that have been recumbent for a period of time upright, give them a little walk around your facility, practice some of your therapies standing. That's a great time to do range of motion activities that we'll talk about in other lectures. It's also a really good time to do some exercises that require at least a little bit of support initially until your patient regains some strength. So there are definitely benefits to some of these carts and these wheelchairs. You just want to make sure you use them judiciously. So to sum it up, in terms of wheelchairs, there are pros and there are cons. And before you decide to use a wheelchair in any individual patient, you want to think through what is your goal, what is the objective that you're trying to achieve, and how will this be used either as part of the rehab program or as an indefinite lifestyle and maintenance tool for that client. So again, wheelchairs can be useful as a rehab tool. I do not advocate them as the sole rehab therapy approach. They do allow freedom of movement and enrichment. They support appropriate posture, which can be very, very important. And because they allow the pet more independent mobility and they allow clients to resume a more normal pace of life and their more normal schedule with walks and so on, they do help reinforce the human-animal bond. Clients really like the feeling of seeing their pet up and walking, and I think the patient really appreciates that as well. It's a huge ego boost, confidence booster for that, and that should not be discounted as a benefit of the wheelchairs. On the other hand, keep in mind that the wheelchair is not a complete mobility solution, and a lot of times clients really need to be talked back from their initial expectations about what a wheelchair is going to provide and what it's going to do for them. It is not a solution. They're managing these patients, whether they are at the beginning of their recovery and they ultimately will be able to walk independently, or whether they've reached a point where we don't expect them to regain full voluntary motor or ambulatory ability. Regardless of where in the recovery process we are, there are always going to be other approaches, other techniques, other tools that need to be incorporated in order to provide the best quality of life and the best outcome for that patient. Again, you don't want your patient to become reliant. If there's any chance at all that you can improve that patient's stamina, strength, proprioception, motor function, balance outside of the wheelchair, I would recommend prioritizing that approach over putting your patient in a wheelchair. All of those things are going to suffer when a patient is put in a wheelchair because the wheelchair does the work for them. And the last thing you want in rehab is for your patients to become reliant on something or someone else doing the work for them. The whole goal is to get your patient to a point where they can do it themselves. Again, doesn't provide normal proprioceptive feedback, which is so important and something that I think in general we tend to overlook. There's not normal weight bearing, postural reflexes are not reinforced. And an improper fit, even subtle things, can make spinal or orthopedic disease distal to the primary problem even worse. It can also cause rubbing or pinching or discomfort that the patient will respond to, but because they can't tell you what hurts, you may not initially understand or recognize, and especially clients may not really understand or recognize why their pet seems worse after using a wheelchair. And they may not even be able to relate it back to the wheelchair itself. They just know that there's something that's not getting better. So again, keeping in touch with these guys, making sure you follow up after you've started a patient in a wheelchair is very, very important. All right. So then moving on to slings and harnesses. This is another area where I think that there's so many options, and really you want to think first about what is your goal. So just going through the slings and harnesses that are here, and again, this is not an exhaustive list, it's just some representative examples. The one on the center bottom, the belly sling, is a variant of something that we all probably have or have seen in any veterinary practice, because they're so incredibly useful. They tend to be cheap, durable, they go in and out of the washing machine with no problem, and they're easy to apply. You pick them up, you put them under the belly, and you're off. They're not real complicated. So for all of those reasons, they make an excellent tool for kind of everyday short-term use, especially in the rehab practice. This is the kind of sling that you might want to have in your practice to use on your patients, rather than maybe recommending for the client to use at home, unless you expect it to be very, very short-term use at home. Immediately above that and to the left, we have the rough wear harness, which is by far the most durable harness I've come across. Very, very well designed. For a lot of our patients, it may actually be over-designed. Rough wear, their main primary market is healthy pets that are very active and going outdoors and doing activities with their owners. And so they're built with that in mind. They're not necessarily built for the debilitated patient. However, if you have a client that needs a handle and wants a good harness, this is a great product to recommend. And there's one other instance, which I'll come to later, where I do recommend the rough wear harness over some of the other ones. On the right-hand side, we have some just generic products these happen to be from Orvis, but a number of companies make these kinds of products for clients to use. They're not bad by any means. They're useful for what they're useful for. But again, the top one is basically a glorified version of the belly sling, which is excellent for short-term, brief use. However, with this sling, one of the things that we want to do is, if we're going to be using it every day or for long periods, one, it's hard on the owner. It puts a lot of strain on the shoulder and the elbow, and so that can be difficult to navigate. Also, though this picture doesn't illustrate it perfectly well, you can see, even from this picture, given the position of the sling, that it's going to place a lot of pressure on the belly and especially on the bladder. And for many, many of these patients, bladder control, bladder maintenance is already an issue. The bladder may be a little bit irritated, inflamed. It may not be fully emptying, and putting additional pressure on that area can lead to discomfort, which is maybe the best case scenario, but in worst case scenario, you're actually going to cause compression and tissue damage as a result of this type of sling. So it's not a great sling for long-term use or repeated use. The other consideration with a belly sling is it's going to pull up on not only the abdomen, but also the spine, and you're going to cause an abnormal kind of arched posture. Even in the best scenario, when you're using this, if you are applying enough weight to support your patient, then that is going to cause a little bit of strain on the spine. So you do want to be careful about that. However, a sling like this is perfect for weight shifting exercises, stepping, standing, balance board activities where the patient isn't quite ready yet to be fully independent, and you are either providing a little bit of support, maybe 10, 15, 20% of the body weight you're supporting, or else balance, so side to side, preventing falls. Even if you don't support the weight at all, a belly sling like this, just slung loosely under the belly when a patient's engaging in some of the therapy activities, can be a useful tool for preventing injury and preventing falls and building confidence in that patient. Orvis also makes a front end harness, which for some of our patients with shoulder, elbow, and neck pain, that can be useful. Some of the same drawbacks. And if you have a patient that's affected in more than one leg or more than one site, having an either or front or rear harness is not always the best solution. The walkabout rear harness up at the top is another one that's very commonly used in a lot of hospital settings. It's really very durable, washable, tends to be extremely comfortable. A step up in difficulty in terms of putting it on from the belly sling, because you do have to get the dog's little legs through the leg holes, which can be challenging. And the biggest challenge, of course, is going to be your post-op patients who have just had say a TPLO surgery or an FHO surgery. Those patients are already painful, and then you're asking them to manipulate their leg through a hole in this harness, and it may not be the most pleasant experience for you or the patient. That said, these are very secure. They provide excellent weight support. They don't put as much pressure directly on the bladder because they do sit a little bit further back. The handles are very long, and so they're convenient for the user as well, the technician or the owner or whoever's actually manipulating the patient. They have all the same advantages of the belly sling in that they can be used for therapy. They do take a little bit longer to take off and put back on again. And then the metric rear sling that I have over on the left is just another example. This is very, very similar to the walkabout, but letting you know that there are alternatives. And so there's different ones, and both the walkabout harness and the metric also come in a front end version as well. So that can be helpful if you have a patient that's got front end disability. Then we come to the Help 'em Up, and the Help 'em Up sort of fits in a category of its own because it is, unlike the other harnesses and slings that we've looked at so far, it is a front and rear support. The Help 'em Up is also, in my experience, one of the most useful tools in rehab. And these guys have been around for a little while now, and they really have perfected the design of this harness. It is comfortable for long wear. It's very durable. It's easy to wash. It has a handle in the front and the rear. It provides support, excellent support under the chest for a variety of size and shape dogs. And it also allows you to maintain proper spinal alignment when you're lifting and manipulating the patient without putting a whole lot of pressure on the belly. So for all of those reasons and many more, I can't say enough about how much I appreciate and use the Help 'em Up harness. There are others that are on the market and are being developed. And to be honest, I haven't tried all of them, but of the other front and rear end harnesses that I have tried, they really just haven't yet come up with a design that beats this one. That being said, the Help 'em Up is complicated. There are a lot of buckles and straps and fasteners, and fit is absolutely essential. In order to get all the benefits of the Help 'em Up that I just described, you're going to need to make sure that it is fitted appropriately for your patient. This is one of the things where I do not recommend sending this product home in the packaging for the owner to figure out at home. You're going to have a frustrated owner, and more likely than not, you're going to have that patient come in for their next therapy appointment, and the harness is going to be too loose with the buckles fastened in the wrong spots, or falling off because one of the buckles isn't fastened at all. It's a complicated harness, and that is probably its one biggest drawback, but it is so useful. It's worth spending 10 minutes with the client before you send them out the door, showing them, putting the harness on the patient, showing them how you're adjusting it, how you're fitting it, and why you're making the adjustments you're making so that they can replicate that at home. I've gotten to the point where once I've got one of these fitted, I can take it on and off by unfastening 2, sometimes 4 buckles at most, and leave everything else buckled. And I often will tell the clients, don't unfasten every buckle every time. You're just going to frustrate yourself trying to put them back on. But the biggest use for the Help 'em Up that I have come across in my rehab practice is during therapy. And a lot of times I do have these Help 'em Ups in stock in my clinic, and even patients who don't have one at home will go ahead and put one on them for the day when they're with us in rehab, because we can use it when they're on their walks. If we just have to take them out to eliminate, it gives them, it's a really sturdy, secure way to walk these animals. We use it during therapy for just like we would have for the belly sling, but for exercises that require additional support, weight support or balance. For patients that are affected in all 4 limbs, they're absolutely invaluable. And then, as I mentioned in the underwater treadmill lecture, you always want to make sure that you have a handle of some sort on your patient. These harnesses can get wet. They dry relatively quickly. If they get soiled, they are machine washable, although typically I recommend hanging them to dry. They can be dried in the dryer, but I don't recommend that. But you can put them in the washing machine, hang them to dry, and they are ready to go again in 4 or 5 hours, which is pretty good. And if the client uses them during the day and washes them and hangs them, they're good to go the next morning. So it's really pretty convenient. These can also be left on for extended periods. You don't want to leave them on 24/7, but they can be left on for the day when a patient is with us in rehab. And as long as they don't get wet or dirty, then you can leave them on for several hours at a time. I also, since we're on the subject of slings and harnesses, I generally recommend talking to your client about using a chest harness at home versus a neck lead. And we will actually, in my practice, keep harnesses, just a set of very, very simple step-in harnesses on hand in a number of different sizes to have for control of our patients. Neck leads, besides the fact that they do put pressure on the airway and we don't want decreased air capacity during exercise, they also don't give you maximum control. And if you have a patient that has rear end weakness, they aren't giving your patient the support that they need. A chest harness gives you more control over the patient's movements and more control over stopping and starting, as well as allows you to provide a little bit of support, weight support when you're maybe doing more challenging activities, going over uneven terrain, those kinds of considerations. So if your clients are using a neck harness, regardless of the rehab conditions that they're being seen for, I recommend talking to them about a chest harness. At the very least, during their home therapy sessions, a chest harness can be very, very helpful. These are just a couple of, again, sample harnesses that are out there. World's Best Dog Harness has such a reassuring name, but all of these come very well reviewed and regarded by people that I've talked to and online reviewers. There are any number of harnesses out there, and so I would just simply choose one that you like best and have a few on hand and make sure you have one that you can recommend to your clients as well. This 2 Hounds Design Freedom No Pull harness down on the lower right is one of the more complicated harnesses. It's very, very adjustable though, and it's actually the one that I prefer for keeping on hand in the practice, not least because it comes in all of these great colors and you can color code. You know, these go in the underwater treadmill, or these get used on patients that have known skin disease, or just color code them by size so that you can know exactly what size you're grabbing without having to check just by the color. But being able to color code your inventory is very, very handy. So when you're thinking about slings and harnesses, just to kind of sum this section up, when you're choosing a sling or a harness, especially in a rehab practice, it's really important to know if it can get wet. That may be one of the primary considerations. And if it can't, or it has a lot of parts that might rust or wear and tear if they get wet, or stretch if they get wet, then that might not be the best harness to choose for your patients. Is it sizable? Is it adjustable? Some of the same considerations we've already talked about. In general, the more buckles, straps, handles, whatever it has, the more secure that harness is going to be, but also the more complicated and difficult it's going to be. We often joke that part of passing the veterinary students through their curriculum, there should be a quiz on all the different harness types and whether they fasten up top or on the bottom or in the front or behind the ears, or, you know, there are so many different harness styles out there. You probably can't become familiar with all of them, but pick one that's easy for you to use and easy for you to demonstrate to your clients. Again, be careful about placing pressure on the belly and the bladder. Maintaining posture and spinal alignment is so, so important for keeping your patient comfortable and preventing sort of downstream effects from their disability and from the rehab program. It is also important to remember that the harness does not give you license to sort of drag the pet along at your speed. You still, even with a harness, need to move at the pet's speed. And for a lot of our rehab patients, our older patients, our geriatric patients, or patients with orthopedic disease, obese patients, neurologic patients, all of them, they really aren't going to move at the speed that you or they are accustomed to, and you need to work within their abilities. Otherwise, whatever you're doing with the harness, whether it be just a walk for pleasure or a therapy program or getting them comfortable to eliminate, those things are not going to be as successful if you're using the harness incorrectly in that regard. Again, we talked about the way harnesses can be used as part of the rehab program, and it is important to note that any harness that's wet or soiled really shouldn't be used anymore. The patient should always, always, always be kept clean and dry. And for some of our patients, that means changing the harness multiple times a day. And certainly if they go in the underwater treadmill, any harness or equipment that they use needs to be completely dry before the next session. So moving on, the other category of equipment that you might want to consider for your practice is lifts. And there aren't a whole lot of options out there, but what's out there is actually surprisingly accessible and even relatively affordable for most veterinary practices. Up on the left-hand corner is a picture of a Hoyer lift, and this image is actually taken from Walmart.com. So I put that one, there are medical suppliers where you can purchase Hoyer lifts, but I put that one in particular up to demonstrate that there are outlets and suppliers that are really readily available to all of us. You don't have to have an account with a medical supplier to get a lot of the equipment that I'm talking about today. You want to make sure, of course, that you're still buying high quality equipment and that there is a good customer service program and warranty on the product that you're purchasing. But in general, you can think a little bit outside the box when it comes to rehab equipment. As far as a Hoyer lift goes, these are designed for people, so they aren't perfect in the veterinary setting. However, they can be very, very useful for lifting large patients and moving them about, especially when you need to do so quickly. They usually come in an electric and a hydraulic version. Personally, I advocate the hydraulic version if you can. One, they're cheaper from the start. They're easier to repair if they break, and they're much, much less likely to break. The electric versions, if they get wet or they're left unplugged for a long period of time and they lose their charge or the cord gets cut or they get knocked over, those are going to be a little bit harder to repair and certainly more expensive to replace. I absolutely advocate investing in a stretcher. It doesn't have to be a fancy stretcher. This one happens to have an aluminum frame, which can be very, very helpful, but there are also fabric stretchers available, and you can get those from most medical supply companies. Even, again, Walmart, Target, that kind of place may carry some of this equipment. Very, very handy for larger pets that need to be, or very fragile patients that need to be moved from one place to another within your practice, or even transporting these guys in and out of the clinic to the owner's car at the beginning or the end of their stay. A stretcher can come in extremely handy. And for a lot of us that are in a hospital setting, there are stretchers already available. So just make sure you know where those are and that you have access to them. This doggy lift on the right-hand side is just something that I ran across as I was doing this, preparing this presentation. It's not something I have actually used, and to be honest, it may be a little bit difficult to source. This one, this picture comes from eBay.com, and I wasn't able to find a direct supplier here in the United States. But do know that such things exist and that your clients may end up asking you about them. You also may want to consider investing in a lift table. And these can be extremely useful. They're not the first thing that a lot of people think about when they think about rehab equipment, but especially if you have large patients or patients that you don't want to move or manipulate between, say, massage and acupuncture, but you want to change positions or change your location in the clinic, these are extremely useful for that, and honestly, relatively cost effective. You can get some, especially if you think outside the box in terms of suppliers, you can get some at a fairly reasonable price. Both of these examples are actually industrial tools. They're not from medical suppliers. So they're not designed for medical use. However, with a very, very limited number of modifications, you can make them safe and usable for your patients. The one thing I really would emphasize is if you do get one, make sure it has wheels, because part of the advantage of having a lift table like this is being able to move your patient around as well as up and down, but make sure those wheels lock. Super important. A very few of these are going to be designed without locking wheels, but it is a feature that you absolutely want to check and test. The other thing you want to test with these, and actually with your lifts that I talked about earlier, is the weight limits. So it's rare. However, you will have patients that top 200 and maybe even approach 300 pounds. So you want to make sure that any equipment that you have either can handle those, or that you're aware of what the maximum weight limit is, so you don't try to put a patient on them that's going to max out the capacity of the equipment. Ramps and steps are another very useful device for promoting mobility in your patients. A lot of times this ends up being something that clients are going to use at home, but I absolutely guarantee that they will come to you and ask for your recommendations. And so I recommend picking one or two products that you're comfortable with, that you know that how they work, and you are confident that they are safe for your patients, and just have a little repertoire that you can draw on when clients ask you about them. Ramps also can be useful in the therapy setting. Steps as well, although I think for most of us we have access to stairs of some sort, or stair activity may be something that you're doing with the patient once they've graduated to a home program. In my experience, you're going to use a ramp much, much more often. And so it may be worth considering investing in one, or even having a ramp built as part of your in-house or in-clinic rehab equipment. Things to consider when you're using ramps and steps, or when you're choosing ramps and steps, is that even though the ramp and the step makes things easier, most pets that have significant mobility limitations can't use them unassisted. And especially if there's any concern about proprioception, ataxia, imbalance, you don't want pets going up and down these without some kind of assistance. And again, maybe even having a harness on the pet so that you or the client has a handle in case something happens. But definitely make sure the client knows that the ramp or the stairs are not going to solve all of the mobility issues, because a lot of times these patients aren't just weak, they also have other complicating factors. Check the weight limits. We talked a little bit about that with our lift tables, but it's also true for ramps and stairs. For ramps especially, and especially for anything you're going to be using in your clinic, choose a ramp that has the fewest number of hinges and seams, basically places where toenails can get caught, or points of weakness where, especially for very heavy animals or repeated use, the ramp is going to start to break down over time. The wider the ramp surface is, the better. And that is partly because a lot of our patients with orthopedic and neurologic disease tend to adopt a wide-based stance as part of their compensation mechanism. But a wider ramp is going to be more comfortable, especially for a very large dog, to walk on. It's going to feel a little bit less like they're going to fall off the side of the cliff. So in my experience, dogs will actually refuse to use a ramp, even if it's perfectly solid, if it's too narrow. Any non-skid coating should cover the entire surface of the ramps from side to side. Having two strips, parallel strips up the middle, is not sufficient for most of our veterinary patients. They just aren't going to walk that stiffly or that precisely for that to really have any true benefit. And anytime you use the ramp, if it's a folding or collapsing ramp, make sure it's fully extended, of course, and supported and resting securely on the ground. And then we come to booties. Booties is another area where there are definitely mixed benefits and a lot of different opinions about when and how to use them. So I'm going to give you mine, and you can take that and use it as you will. There are a ton of booty products on the market, so many, and the screen is already crowded, but I could have added 10 times as many different products on here. So this is one of the products where it is most important to really think about what is your goal. Why are you recommending or using a booty on this particular patient? Most often, with rehab patients, we are using the booties to either provide traction or to provide protection because the patient is knuckling or dragging the toes. For traction, booties do tend to fit the bill. Most of the booties that are pictured here and a lot of the ones that are on the market are going to provide a little bit of additional traction. There are some drawbacks to that, which we'll come back around to. For protection for knuckling and dragging, in my experience, most booties on the market don't actually cover the parts that need to be covered. So the dorsal aspect of the paw is what's knuckling or dragging on the ground, and for most booties that are designed for healthy, active pets, the dorsal surface of the paw is actually the least reinforced. And so you can certainly have your client purchase a pair of booties and use duct tape over the toe. I've done that on more than one occasion, and it works just fine. It's not very cosmetic, and if you're going to spend $65 on a set of booties or more, you don't necessarily want to have to use duct tape to reinforce them, so there may be other approaches. The other time we might use a booty is if we have a wound or a bandage that we need to protect and prevent from getting wet, and so there are booties that are available for that, like this Vet Good protective boot, and again, a number of other similar products are available. When we're talking about boots, again, they can be protective and they can add traction. However, there are a number of disadvantages to boots that you do want to be aware of before you prescribe or use them. Most of the boots that are on the market that are at all decent quality are going to be fairly expensive, and they're going to be one of the things that your client's going to have to replace fairly often. So it's a recurring expense that's fairly significant. I have yet to find a booty that is designed so that it will stay on every type of dog, every type of activity, regardless of what else is going on. And so invariably, I will have clients come back after they've started using a booty, and they will complain that a boot fell off or they lost it in the woods, or it's too difficult to get the boot on because the patient doesn't like wearing them. They just generally don't stay on well. Really, really important for neurologic patients is the fact that booties are going to decrease your sensory input and proprioceptive feedback for these guys. They dull the senses in a patient that may already have limited distal sensation. So you want to be very careful about actually compromising your patient's ability to feel the ground, and also keep in mind that feedback and that sensory input is so important for reinforcing sensory and motor pathways as part of their recovery. And so you can actually theoretically delay or stymie their recovery by putting boots on, especially if they wear the boots a lot of the time. Boots will also collect moisture. So keep in mind that pododermatitis is a real concern, and if patients are already either predisposed to skin issues or they have a tendency to lick at their feet, then applying a boot either before or after underwater treadmill or during an exercise session may actually cause the moisture to collect, and that's going to lead to an increased risk of irritation and infection down there. So you want to be very careful about that. Again, with neurologic disease, dogs that have absent or very early returning sensation in their distal limbs are already inclined sometimes to self-mutilate. They will chew their toenails and their toes until they bleed, or even in some cases until they amputate. And if you put a boot on a paw that already feels a little bit funny, you're going to draw the patient's attention to that paw, and you may actually increase the risk that they will self-mutilate. In those patients, if you do decide to use a boot, and sometimes there are instances where it's absolutely appropriate, you do not want to put the boot on without an e-collar. And a lot of those patients should be wearing some kind of e-collar anyway to prevent that self-mutilation. So boots are a mixed bag. I think if you're going to use them, be sure you know why you're using them and what you want to accomplish, and use them for only the period of time that's needed in order to accomplish that goal. Also, choose a boot that's going to meet the needs of your patient. And so depending on what you're looking for, where the boot is reinforced, the materials it's made out of, how it fits on the foot, how much of the foot it covers, all may be important considerations. If you're using the boot as a protective device to prevent dragging or knuckling of the toes, you may actually want to think about an anti-knuckling device. And again, there are a number of these on the market. The ones that I've used are pictured here, and I think that there are pros and cons to all of them. The OrthoPets Toe Up and the Therapod Dorsiflex, which are at the upper left-hand and lower right-hand corner of your screen, are the most similar in design. In my experience, these are very, very effective for reinforcing normal paw placement in patients that are knuckling or dragging. However, you'll note that both of these designs incorporate a boot into the design, and so they come with all of the same drawbacks that you have with the boot. That may be all right for your purposes. If you have a patient that has normal sensation and just needs a little bit of help keeping that paw in the correct position when they're walking to prevent damage or to reinforce normal proprioception, these are really entirely appropriate alternatives. They're both pretty sturdy. They're both pretty washable. So I've had good experiences with both of those. If you have a relationship with a prosthetist that works with soft materials, you may also be able to design a custom boot using a similar concept. Obviously, you can't replicate these designs precisely. You don't want to because they're protected and they're difficult to replicate. But you can certainly, under certain circumstances, if you need a very custom product, that can be done as well. The Beco brace was actually one of the earliest products that was developed in order to address this problem. And you'll see that both the Beco brace and this anti-knuckling device attach to a harness. And this is the exception that I mentioned earlier, where if I'm recommending a harness, this is the time when I will specifically recommend the rough wear harness. And the reason is if you are using one of these two devices unilaterally, the rough wear harness is the harness I've found to be least likely to drag or pull to one side. It tends to not shift and it will stay in place even when you're using these devices. So that's my recommendation. I'm sure there are other harnesses out there that may fit the bill, but generally speaking, if I'm selling a client one of these devices, I'm also recommending that they go out and purchase that rough wear harness. So the main difference between the Beco brace and the anti-knuckling device is where the device is positioned on the foot. And if the patient is having significant difficulty dragging the toes specifically, the Beco brace may not fully address that problem. The Beco brace is going to increase the amount of lift or rise that the patient gets with each step, so it will almost certainly increase stifle flexion and hock flexion, which you probably want in some cases. You may not want in other cases, but you need to keep that in mind. But it won't necessarily correct the problem if the main issue is below the hock. The anti-knuckling device does a better job of correcting that toe knuckling and dragging, and so it will address that problem. It does not cause quite as much flexion of the hock, the hip, and the stifle. But the one drawback in my experience with the anti-knuckling device is that it's a pretty complicated little device. It's a figure 8 with the buckle, and once you are used to how to put it on and take it off, it becomes pretty straightforward, but for some clients, it can be frustratingly difficult to remember how this particular device fits and around which toes and so on and so forth. So it takes a lot of client education. It may be better used as a tool in the therapy setting rather than at home. And then if you're looking for increased traction, which is another reason a lot of times we'll turn to boots, but you don't necessarily want to use a boot, there are other alternatives for this as well. In fact, there are a number of alternatives for this. There are boot type products, which are more of a sock with a rubberized bottom, like these grippers and the pup techs in the lower right-hand corner. The pause booties on the left-hand side are my personal favorite traction promoting device. Pause booties, for those of you who aren't familiar, are basically a very, very thick rubber balloon that you fit over each individual paw of the patient. And they are fantastic for promoting traction in a patient that slips on slick floors or wet floors, which might occur in your rehab practice. And so they're fantastic. They stay on. They're fairly comfortable. However, as you can imagine, they're non-porous. They are not permeable, which has benefits if you're putting these guys in the water. They're also great for protecting abraded knuckles in dogs that are knuckling on land. When you put them in the underwater treadmill, they do help a little bit with that. However, you cannot leave a dog in pause booties for any length of time, or you absolutely will get dermatitis and irritation and moisture collection in the boot. So typically I will recommend about 15 minutes at a time for use with these guys, and you could probably push that to 20 minutes if you need to, but anything more than 20 minutes and you are going to increase the risk of problems. The nice thing about the pause booties, though, is that they come in a pack, usually of 12 or 14 pair. They're not completely disposable. You can usually get a couple of uses out of them. They will eventually perforate or abrade, and so you can't use them repeatedly, but they're inexpensive. So when one pair does wear out, you just grab another pair out of the box. And so you can have a client pick up a pack of these and either use them at home if they have hardwood floors, or a lot of times I'll have clients pick them up when they are going visiting family and they expect that their pet is going to have trouble on the floors, just for getting them in and out of the house. I've had multiple clients buy a pack of these just to get their patient in and out of my clinic. I don't know about the rest of you, but in a lot of hospital settings, we have linoleum floors or very, very slick, highly polished floors, which is great for keeping them clean. Not great for our patients with mobility issues. And so we'll keep a pack of these, run out to the car when the patient gets here, put on their little booties, walk them into the clinic, and then take them off again. So they're great for short-term use. They're absolutely fabulous in terms of getting them to stay on. They come in 7 or 8 different sizes, so sizing is generally not a problem. On the right-hand side are these toe grips product, which is another product that I've had a lot of my colleagues tell me they really, really like using these, that they've had good success with them. I definitely have had clients who prefer these over a booty as well. They're put on over the claw, kind of like soft paws for kitty cats. Not over the paw, over the claw. I can't remember which I said. But and then they provide a little bit of extra traction for the pet walking around. They stay on all the time, or they're intended to, until they wear out or fall off on their own. So they are a longer term solution than a booty, and they're certainly lower maintenance. I do have some clients who've had trouble getting them to stay on, so they'll find a toe grip randomly, in the couch cushions or in the dog's bed. But in general, I think they do stay on for a fair period of time. And they do seem to work. I recommend putting them on in the clinic because they can be a little bit frustrating, and you do have to sort of manipulate and sometimes squeeze that little rubber thing over the toenail, and that can be a little uncomfortable for the patient. So you want to make sure that it's done in a safe manner, and that you get the grip as high up on the toenail as possible. My personal opinion, and I will share this knowing that many, many people disagree, is that if the toenails are long enough for these toe grips to fit on them, then they probably need to be trimmed. And as I say that, I know that my own dog right now needs a nail trim. And so, in fact, you may have heard her clicking around here as I was talking. So I am not the poster child for keeping my dog's toenails appropriately trimmed. But my dog, at least currently, is able to navigate without additional support, so it's less of an issue. For dogs that are slipping on hardwood floors or slick floors, trimming the fur between the foot pads and keeping the toenails short may be just as effective as these toe grips. I think it just depends on your client, what they prefer to do. If they want to wrestle their dog to put the toe grips on, or if they want to wrestle the dog for a nail trim, that's up to them. And then, of course, it's up to you in terms of what you find to be most useful in your practice. Lastly, we have these traction foot pads, which are newer in the last couple of years. There are a number of companies that make foot pads that actually stick on the bottom of the dog's foot. And so they eliminate the need to trim the fur because they just cover it right up, and they provide traction without covering the paw. And I personally think this is a great idea. However, in my experience, my patients don't agree with me, and they find these to be really irritating, and they want to shake them off or chew them off. And ultimately, they don't stay on very well for a number of reasons. However, if you have a patient that tolerates them, they might be a good solution. And they're sort of, in terms of duration, they're a little bit of a mid-range between the paws booties, which you can use for maybe 10 to 15 minutes, the toe grips, which last for 3 to 4 weeks. These traction foot pads would be maybe a few days you could keep them on and use them. So you would be replacing them fairly often, simply to prevent irritation to the toe pads. Lastly, I want to talk about some equipment that you might want to think about that's not necessarily going to promote mobility, but may be useful in a rehab setting. And one of the things that we do all the time in rehab is apply heat and cold. And whether we're doing that in the clinic or recommending it as part of the home therapy plan can vary depending on the patient. But it is absolutely a mainstay, a fundamental technique that we are going to be using all the time in the vast majority of our patients. And for that reason, it's important to have the right equipment. So I wanted to point out these Caldera packs, which are illustrated in the little the doggy pictures, whether there are 6 across the top and 4 on the second row there. This Caldera company has designed packs that are wearable, which I think is brilliant. And these packs can be used for heat or for cold. They come with a little gel pack that fits into an insert within the wearable device. They come in a number of sizes so that you can put these on anything from a Yorkie to a Mastiff. And they cover different joints. So the hip, the shoulder, elbow, carpus, tarsus, all of those areas are going to be addressed. And I think that this is great for both the clinic setting potentially and also at home. If you are, for instance, using ice therapy and you're asking your client to ice for 10 minutes 3 times a day, on top of any rehab program, any massage, any visits to the hospital that they're doing, you're taking a fair chunk out of their day in order to get this treatment done. Likewise, in the practice setting, this is a significant part of the technician's time with that patient. And so if the dog can wear the device rather than having someone sit with them and actually hold it on, that frees up someone's hands to do other things at the same time. I am not advocating, and I think it's very, very important to make sure your clients know that patients still can't be left alone with these on. They need to be watched because dogs will chew on stuff. And so things get chewed, the gel packs get ripped open. These are not inexpensive. They're definitely reusable, but they're not inexpensive, and you don't want to have to buy another one because the dog chewed it. You certainly don't want to be doing a foreign body surgery because they swallowed part of it. So these cannot be used with the patient unattended in any scenario. However, the patient can get up and walk around, so they can be in a cage or a kennel. And certainly the therapist doesn't need both hands to keep them on. So that's a really handy tool to consider. And if you haven't seen them already, I recommend going to the website and taking a look at them. If you want just more traditional packs for icing and heating, my favorite so far of the ones that I have tried are the Elastogel Therapy Wraps. These are a human product, which is why I have a human picture here. But they are incredibly durable, very useful. They come in an array of, there must be 30 different shapes and sizes. They do strap on. And for instance, the knee pack that's illustrated here makes a great hock wrap for your larger breed dogs. They have a neck wrap. They have some that don't have the Velcro straps that are just rectangles that come in a variety of different sizes. They've got a hip one. They've got any number of them. The material inside is really soft and pliable, and these can be washed. The cover comes off so you can run the cover through the washing machine, unlike a lot of our rice packs, which if you soil the outside, you're kind of done with that pack because they can't be thrown in the washing machine to wash. So for a number of reasons, I do like this Elastogel pack. I understand, I don't know this from personal experience, but I understand that the gel that's used inside the pack is sweet. So if the inner pack breaks or tears, you do need to get rid of that because pets will want to lick at it or maybe even try to access more of it. But in general, I found these to be very, very helpful. They heat up very, very quickly, which is a time saver, but also we need to be really, really careful when using packs like this that we test it on ourselves first before putting it on a patient for extended use. The other product you may want to consider having, and I've emphasized this more than once, is just a set of traditional e-collars or these non-traditional protective collars. The Bankmate Small Pet Recovery Collar, which is pictured in the top 3 pictures, and really you only need the top right-hand pictures to get an idea of what this is, but I mean, goodness, look at that puppy. I couldn't resist. So you have 3 pictures of the Bankmate Small Pet Recovery Collar, and these I think are a fantastic idea. They overcome some of the challenges with some other inflatable collars that I've used in the past. They're soft. The cover is washable. The other thing about these is that the very teeny tiniest size, which I think is actually designed for kitty cats, is great as a donut bandage if you have a recumbent patient that's at risk for developing or has started to develop decubital ulcers. It makes a fantastic bandage insert so that you can get one of these or have the client get one of these, send it home with the patient. They're washable, they're cleanable. You don't need to worry about, is the bandaging coming loose? Is the client having to remake the donut every day? Those kinds of considerations can be sort of overcome with these. There's also this Kong cushion, and some of you guys may remember this one as the Boobaloon, Booboloon, which I thought was a great name, but that no longer exists. It is now the Kong cushion, but same concept. These have a Velcro attachment in the back. They're entirely plastic, so they are washable, but they're not machine washable. They're relatively inexpensive, and they also come in a number of different sizes. Life vests is something I haven't touched on a whole lot because I think that depending on whether or not you have an underwater treadmill, it may not even be an issue for your practice. I do think if you have an underwater treadmill, you should have a full set of every size of life vest because you will want to use them on some of your patients. And again, you don't need to use them on all patients that go in the underwater treadmill, and I addressed that also in the underwater treadmill lecture. But I do think that having them available is essential if you're going to invest in an underwater treadmill. I've only got one pictured here because if I had endless budget, this is the only life vest I've found that I've really ever been super happy with. The Roughwear brand makes an absolutely top quality product, and they come in every size from mini to giant. So they're a really nice product. They're very sizable, they're very adjustable, they're incredibly durable. The handle is comfortable, pieces don't fall off of them, they can get wet and dried repeatedly. I've been very, very happy with them. They are, in my experience, the most expensive product on the market for life vests, so that would be a consideration, and buying a full set of them is not inexpensive. But if you're investing in an underwater treadmill, then you might as well go ahead and invest in your equipment that goes with it as well. Last slide here is just some miscellaneous products that might be useful in a rehab practice. And I think therapaw.com is a site that has a number of interesting products, and it has a veterinary only section, so you can actually register with them as a veterinary professional and have access to some of their prescription products and that kind of thing. They have a number of mobility devices. They do have a section of products that are available to clients to order directly as well. They offer spare padding, spare Velcro. If you are having problems with the device, either that you've made or you've ordered elsewhere, you can definitely manipulate that. Their foam padding is another option that's great for building a donut bandage or for building any kind of bandage, protective bandage that you might need in your practice. This anti-chafing powder you can also get at most baby supply stores, but they sell it at Therapaw, and it's great for patients who maybe have a splint, bandage, or adaptive device that they're going to be wearing for extended periods of time. So prosthetics and orthotics, this is a great product for your clients to have on hand, especially if the product closes in the foot or the toes. And this can also be applied with patients who wear booties for extended periods of time. Handicappeds.com is another website with a wide variety of equipment and supplies, some of which I've found to be very, very useful. Other products I have really not been as happy with, but I think that a lot of that comes down to individual preference. They do carry this drag bag product, which is a great solution for a patient that's non-ambulatory for an extended period of time or indefinitely. Again, for those periods when that patient will not be in the wheelchair. It means that they can wander around the house and they don't have to be confined whenever they're not in the wheelchair. It does help prevent soiling and accidents in the house, and given the choice, I would prefer one of these over a diaper because of the dermatitis and the urinary tract infection issues that diapers can lead to. But more importantly, it prevents abrasions, cuts from just running across the ground and maybe getting injured that way. It also keeps the patient clean, which if you're in a setting where maybe the floors aren't perfectly clean all the time, or you're taking your patient outside into the mud and the dirt, a drag bag can be really helpful in terms of preventing a bath when you get back inside. All right, that is all I have, although it's quite a lot. I look forward to your questions when we meet in person, and if you have any other product suggestions or things that you've used, I really do look forward to hearing those as well.